Hello and welcome to our family presentation about the Northwest Cork Children's Disability Network team. Just to give you an overview of today's session, we'll look at what is Progressing Disability Services and how the Northwest Cork Children's Disability Network team will support your child and your family. Just to do some introductions, my name is Maeve Howlett. I'm the Children's Disability Network Manager for Northwest Cork. I'm here with Stan Lennon, who's a social worker with the team, and with Judy Borhill, who's an occupational therapist with the team. All Children's Disability Services are working together to provide new disability services for your child and family. So in Cork, Kerry Community Healthcare, all of these organisations, Cope Foundation, the Brothers of Charity, St Joseph's Foundation, Enable Ireland, Co-Action and the HSE have come together to roll out this national initiative, which is Progressing Disability Services. So this is a national plan looking to reorganise children's disability services. Each team will have a disability network manager and will cover a specific area. So in North Cork, St Joseph's Foundation is the lead agency. So it's the lead agency for the Northwest Cork team and also for the Northeast Cork team. And team members include clinicians from St Joseph's Foundation, Enable Ireland, Cope Foundation, the HSE and the Brothers of Charity Services. So for the Northwest Cork Children's Disability team, our bases are currently between Mallow and Charleville. So we're working from Ross House in Mallow and also from St Joseph's Foundation in Charleville. Long term, we're looking at getting a base, we hope, in the Blackwater building, which is beside the Primary Care Centre in Mallow. So what is Progressing Disability Services? As I've mentioned, it's a national programme to reorganise children's disability services across Ireland. And it's changing the way children from 0 to 18, children and teenagers from 0 to 18 and their families access and receive supports. It provides a clear pathway to services according to a child's need and not according to their diagnosis. So the vision for children's and young adult services is that services would be needs-led, that children and young adults would attend teams based on their home address, that there would be timely access to service, that there'd be easy access to services, that teams would work in an interdisciplinary model, and that services are equitable or fair. And then the overarching principle is that we're working in a family-centred model. This next slide here just shows you a map of Progressing Disability Services and how it's rolling out across the country. So you see the green areas are already reconfigured. The yellow areas are partially reconfigured, and the red areas, and looking at where we are in Cork and Kerry, have just started to reconfigure. So as I've mentioned, children attended a Children's Disability Network team based on their home address. So your CDNT is the Northwest Cork team, and we cover Charleville, Buttevant, Kanturk, Mallow, Mill Street, Newmarket, and the surrounding areas, as you can see from the map here. The Children's Disability Network team includes parents and guardians, the Children's Disability Network manager, administration staff, occupational therapists, physiotherapists, speech and language therapists, social workers, clinical nurse specialist, an early intervention specialist, family support workers, and psychologists. And I'm now going to pass you over to Stan Lennon, who's going to talk a little bit about family-centred practice.
Hi, my name is Stan Lenihan, and I'm a social worker with the St Joseph's Foundation team. So I wanted to just introduce family-centred practice, and that it's a cornerstone of how we are going to work with you as a family. This is evidence-based and with proven outcomes for children and families, and it is considered best practice. The overall theme of this approach is working in partnership with everyone involved in the child, and to achieve the best outcomes possible for the child and for the family. And working with young children within their home, school, and community is believed to be the best way of working with children and their families. So this model here is showing you that the child is at the center of all our work, and the different components that support the child with family, the health team, the school, therapy team, community. So it's a very much a holistic approach. And parents as partners in FCP. So this is a fundamental part of the approach where we can appreciate that you know your child best and you're the most important member of the team when it comes to us working with your child. And our focus is to build on and enhance the skills you already use as a family unit and to support your child's development. The initial pathway is the beginning of your shared journey with us. And just to give an outline, right now, when we have formed, what PDS has happened, and we are now reviewing the information of each child and family, and we're prioritizing those needs and planning for individual and group intervention as we speak. So the CDNT initial pathway. So there's an introductory session for parents, which is what we're doing. And then we're going to talk about the key contact, which is an important concept of progressing disability services. And you will have a key contact assigned to you, an initial assessment if required, and the individual family service plan. This map shows the various, I suppose, the process and of what happens to when you're initially referred, and where the start and the end point is. So the key contact is a single point of contact for the family, and that person, so links with so you can link with the appropriate members of the team to support your family. You can approach them, and then they can link in with the team about exactly what you need and which team member or what support you need specifically. So the key contact organizes and invites you and appropriate team members to team assessment and to the IFSP, individual family service plan. So it facilitates the IFSP and provides you with the completed IFSP document. And the initial assessment, so that's the key contact and relevant clinicians will read your child's information forms and all relevant reports. So we'll review those first, and then they will observe your child if needed in an initial assessment. And following discussion about your child's strengths and needs, we will help you complete your individual family service plan with specific goals and strategies for your child and family.
Hi, so my name's Judy. I'm the occupational therapist, and I'll just go through with you the individual family service plan. So what we do is, after you've had your initial assessment, or if you don't need an initial assessment, we'll meet with you as a family to go through your goals for your child, what specifically you want to work on for your child, and help you to develop the strategies and interventions we need to help you reach that goal. The idea is to build up your own skills so that you can help your child. We wish to lay foundations by building good relationships with you and your child, and knowing that you are working with your child the most at home. So your input is extremely important, and that we want to skill you up so that you can best help your child. So when we're looking at the goals, we're really looking at function, and it can be in different areas such as your self-care skills. We could be looking at washing, dressing, feeding, sleep, or toileting. It could be family living goals like social engagements, going on trips, understanding diagnosis, helping with dealing with things like screen time. It can also be school-based, so it could be that we need to do school visits or work on independence, on concentration, and just or dealing with bullying or anxiety around school or any other motor skills. It could be goals around community living, looking at safety awareness, mobility to get around to different areas, online safety, and increasing physical activity. And it could be looking at play skills, like building up, interacting with other children while playing, your imaginative play, all that kind of thing are some of the goals that we look at. So just for an example of what the IFSP goals would look like, if we were looking at a child we're looking at toileting and he's not aware when he is wet or dirty, that would be his baseline. So the goal would be that in 6 months, Sean will successfully indicate that he needs to go to the toilet and use the toilet. So some of the actions and supports that we can put into place would be for the family to attend the toilet training workshop. And then other supports that might be needed would be the speech and language therapist to ensure correct means of communication, so that the child knows how to ask, whether it's with a card or pointing or able to just go to the toilet themselves. The OT could advise on after the workshop on where to start and help you plan from there, and also what necessary equipment or sensory issues you might need to work on. Then another goal might be communication. So this child, his baseline is he's nonverbal and will cry in frustration. He does not lead you by the hands or to anything or point. So one of the goals for Sean would be to communicate his needs and wants by taking a picture of what he wants and giving it to his parents and vocalizing. So some of the actions, some of the training you might need is PECS training and Hanen training, which are both around communication. The supports would be using those Hanen strategies or PECS, and the speech and language therapist might need to come in to help you individualize that and set it up specifically for your child. And these are ongoing documents that we do review within 6 months or a year, but also if things change before that, if targets or goals are met, then we just increase it. We make new goals at that stage or move on to the next target. So when we're looking at interventions, we're looking at 3 different interventions in 3 different categories. We're looking at universal interventions, targeted interventions, and then if they need more, then we'd be looking at direct intervention. So if we're looking at universal interventions, these could include family information and training sessions, general family support, visuals, stress management, toileting workshops. And then if we look at targeted, which is more specific, ones we might be looking at training on communication, which would be your Hanan programs, PECS training, or those ones that we mentioned in the sample goals. It might be sleep training, autism information groups, get set for school, groups, anxiety management, or sensory processing workshops. Those are all part of your targeted interventions. And then at the very end, if they need direct interventions, that could be more looking at one-on-one intervention or a therapy, a discipline-specific intervention. So it could be consultations with the school, looking at equipments or housing adaptations that need to be made, or reviewing access to orthotics and orthopedics. It could also be things like speech and language, if they need specific individual targeted intervention to reach a certain goal in language. So as you can see, for each child, it will be very unique to their needs and to the family's needs, and we want to make it specific for that child. Yeah. Other facilities we have at St. Joseph's that could be part of interventions and strategies, or just part of what a family can avail of, is we have the Equine Centre in Liskennet, in Grana in Limerick, where they can do horse riding. There's sensory pathways there, and it can be a time for the whole family to go there. We also have a hydrotherapy pool, which families can avail of, and you can. And then we've just added some useful websites. Those are just a few that you can use to get additional information that you might need.
And Judy, I might just come in there to say, if anybody has any additional queries, to feel free to contact me, Maeve Howlett, at this email address below, mhowlett@stjosephsfoundation.ie. And I'd like to thank Judy and Stan for putting the presentation together with me, and also to reiterate that the teams are working hard to look at every child's and family's needs and prioritise the needs, and to link in with the key contact will be linking in with you over the next few weeks.